everybody. This is Jen Barnahill. I am the lead researcher for Partners in Promise. We're so excited to have you joining us today to learn a little bit of our findings from our EFMP adult surveys. We also added questions this year and started asking our adults, what is your experience with the Exceptional Family Member Program? So we're really excited to have you join today to learn a little bit about that, but also to introduce you to Meg Graves, who is our guest today to talk about her experiences in EFMP, and I'll let her share that. But really quickly, I wanted to just jump in and give you data points, and it's going to be real fast. So you will have to, if you want to learn more, go into our website, thepromiseact.org, and read the full report to find out what's going on. But just really quickly, top level, we heard from military families, from the past 3 years of surveying, and they kept saying, why are you not asking us questions, adults questions? And so we added these questions this year. Our three areas where we had in our report, our findings, cover three topics. One is employment. We noted that EFMP adults have higher rates of not working or they're actively volunteering compared to other military spouses. Also, another area of our report covers accessing medical care. We know that that's a big deal post-COVID, and our EFMP adults are really struggling accessing care as well. In our survey, it said 59.62% of folks reported delays after a recent permanent change of station move. So that's, a large percentage of you who are not accessing the care that they need after a move. And 80% of those previously under mental health care experienced delays in accessing care after moving. So that's a huge impact on our community. And so we're really excited to talk today a little bit, raise some awareness. And then also, over half of our survey participants, our EFMP adults, indicated that they were unsatisfied with the current offerings of the Exceptional Family Member Program. So we really want to find out a little bit, from our guest today, and I'll let her introduce herself, of what it might be like to experience the Exceptional Family Member Program as an adult. And without further ado, I will stop jabbering on about data and share our guest today, introduce Meg Graves. She works with Partners in Promise, and she is also an EFMP adult herself. Meg, can you tell us a little bit about your military journey and then maybe your EFMP journey?
Sure. Hi. So yes, I am the volunteer and outreach coordinator for Partners in Promise. So everything Jen has covered is near and dear to my heart, and I fully love everything that we're doing for our families. We are an active duty Navy family for the last 13, going on 14 years. We have 3 children, 2 of which are EFMP as well, and then myself included. We have one who is neurotypical, and she's just along for the ride. We have been mainly stateside due to the EFMP status of my children, so we have not experienced any of the Oconus dreams that we had when we joined, but that's our journey, and we are perfectly fine with that as long as everyone is cared for. My EFMP journey personally started in 2020. Well, towards the end of 2020, after a year-long COVID deployment, my husband got off the ship, and 2 weeks later, we found out that I had stage 3C triple negative breast cancer. And so that threw our world into a big upside down mess. And it has been an interesting ride. I finished up all active treatment last year in July of 2022. So it has been a year of no new cancer. So woo, that's a big deal. But in between all of that, there was a lot of various doctors, both military and non-military. There has been a PCS move in the middle of it during active treatment, and moving most of my cancer care back to only military hospitals. So I have seen the gamut, the full range of everything that could happen with a military family, the moves, the doctors, all of it. Um, so the EFMP side of things, I've already had a very good connection with our EFMP coordinator in Virginia Beach, due to moving with my boys there and getting their care reestablished after a move. So they already knew me. They knew exactly who I was. And then the moment I was diagnosed, they hooked me up right away with respite care, with all of those things that they knew that I would need because I was the primary caregiver for them. So they knew now that I am now needing caregiving. It changed things. But I work part time now at the thrift store here on the military base, and I love it. But prior to that, I had not been working.
So one thing you shared with me earlier was, you know, when you think of EFMP, your first thought is more of your children, not yourself, and how that program is serving your kids and not yourself. Can you kind of speak a little bit more about that experience and that difference? Maybe you did address, you were already in the program, you had that contact, so that's a fabulous, awesome, positive experience. Um, but when they knew about it, so can you explain a little bit more of what resources maybe you have accessed or know exist for EFMP adults? Maybe that maybe you haven't accessed, but you've heard of, if
Yes.
you have.
Honestly, I haven't heard of much for the EFMP adults. They mainly are a point of contact and they are aware of our status and they are aware that I have complex needs and that I need to be closer to a medical facility. But when I have presented some of my questions, I wasn't given answers that I really could have used, or at least immediate access, especially when it came to looking for mental health stuff in reference to the trauma of being diagnosed with cancer and uh, all of that comes with it. They just pointed me to Military One Source. Um, and I'm also an ombudsman, so I'm very well aware of what is out there for military families. So I felt like I didn't, I wasn't being given anything I didn't already know about. Um, so I already knew about Military One Source and I already knew about the other places I could look, but they didn't really, there wasn't much to offer for me. And the only reason why they even offered respite care, which is care for my children, is because they qualified for it. But if they weren't already in the EFMP program and didn't actually need care, there wasn't anyone to watch my kids when I needed to go to the doctor. There wasn't anyone to watch the kids when I was sat in the chemotherapy chair for hours. We had to really rely on our family and friends to help us get various places around. And chemotherapy isn't just an in and out 1 hour thing. It's sometimes it's all day. I mean, you get there at 8, you have your doctor appointment before, and then you have chemo the entire day. And that's just sitting in the infusion chair. But then when you get home and you feel like death in a day or two, like again, you're stuck at home with 3 kids or however many kids you might have, or even if you don't have kids, you're stuck at home trying to care for yourself. And there isn't anyone else to ask other than your spouse who could be deployed. Um,
And how do you have any recommended resources or any support, something that helped you kind of get through that? Obviously we don't expect, EFMP to be the end all be all of anything. Not one program can do that, right? But
yeah.
as a caregiver of your children and someone who needed care, how did you kind of approach that, as a family in making decisions to help your whole family unit?
I am a pretty organized person, so I already had all of their IEP binders and all of those things that my kids, that would explain who my kids are, and I already knew what kind of needs that they needed. And I just had to learn to relax in some ways. I had to learn that things wouldn't go as we all are used to anymore, and that they can't that they, my children, and my spouse couldn't count on me in the same ways, that I wouldn't be able to handle some of it as I had. So I took to finding it on my own or relying on my friends who also had special needs kids to kind of understand the role that was needed and to step into that role. And thankfully, we had friends in the area who were willing to help us. But there wasn't one specific organization that like stepped in, a couple spouses groups kind of stepped in and offered care or offered us a connection to like a babysitting service, but there wasn't anything specific that helped me as an adult. I don't know what would be out there even for that
Yeah,
to ask.
and your story, is kind of one that was echoed in the data as well. People not they're accessing or familiar with the program because of their children, or they were auto enrolled because they sought care, or the program discovered that they needed care, and then others had this uncertainty surrounding what really the program offered for them as adults. We know that there's a lot of events for children because probably we don't know. We did ask. We are not certain exactly the number of EFMP enrollees who are adults as compared to children. We do know that approximately 140,000 people are enrolled in the program, but the breakdown is something we don't yet know, and we're excited to learn more, possibly when the Exceptional Family Member Program survey that was conducted by the Department of Defense comes out, hopefully in the not too distant future, to learn a little bit more. And I know we only briefly touched on your story, and I know that so many EFMP adults have a variety of different stories. I know that mental health care was a top concern for many, and I'm sure that mental health care overlaps with other diagnoses that might
Yeah.
qualify someone for, like, in your story, mental health care is an important necessity. Kind of to that end, I just wanted to go over some of the recommendations that came out of this survey. You can obviously read more about that in looking at our website, thepromiseact.org. And again, it goes into 3 different areas. One was improving access. We know that access to care is a huge thing for both our children and our adults. It's a huge thing nationwide. And we just recommend that there are any hurdles that are related to TRICARE or things that the Department of Defense can address, that they do, that they look at, and maybe look at how the policies surrounding Exceptional Family Member Program adults access care, and of course children too. We also recommend that the Exceptional Family Member Program conduct program evaluation to better understand the unique circumstances surrounding adults enrolled in the program and what they need. This survey is intended to just kind of address the concerns shared by our community, and is not attempting to be an exhaustive report, but we are hopeful that the DoD will be able to supplement what we've learned and give some more information. And then the last recommendation is related to enrollment procedures. We're really excited that the standardization plan has come out recently, and there's a link to that update on our website as well if anyone's interested in learning more. But we really want to understand the role of OCONUS orders, and we want to make sure that our families have access to the care that they need, but also aren't separated unduly. If there's a way to keep families together, we hope that our detailers attempt to do that, because we know that it will only further exacerbate the mental health struggles. So, Meg, I want to give the floor back to you and see if you had anything else to add about your experiences, or as they overlap perhaps with our recommendations or our findings.
Well, I have a few friends that are EFMP adults as well that don't have children and medically are unable to have children. And so a lot of the programs that are out there pertain, like you had said, like the EFMP programs are mainly aimed at, and the events are mainly aimed at children. But one suggestion that all of us have sort of echoed loudly would be support groups. It's hard enough to go through these unique medical situations, but then to add being a military spouse as well puts a unique spin on it. And the EFMP coordinators already have a database or an access to many of these EFMP families, it would be easy to put together like I mean, I know there are HIPAA laws and all that stuff. They can't share it, but they could share, hey, EFMP families are getting together at a park or
Mhm.
getting together at the library or meet us for Starbucks or something like that. Some sort of generic situation where we can all walk in, and if we would choose to share, that we could share, but it would give us a place to feel seen and heard and not alone, especially those who don't have children at all and aren't aware of all of the things that EFMP can do. Um, and then it would also give us a place to kind of share our experiences with the doctors and be like, we know this good doctor that could help you and has less of a waiting list than other doctors. I thankfully didn't have any delays, but I think that had to do with the severity of my medical condition and my immediate need. But now that I am in the less immediate need, I am experiencing some of those delays with some of my care. Just become less of a priority for them, and that's okay. Like there are more pressing people out there, but I still want to be heard and seen and recognized. So those are some of the things I have experienced, and we would love to go abroad. I really would, but my care and my kids' needs come first, and so that we understand.
Thank you so much for sharing your story, Meg, with us and helping kind of give at least one perspective of what this program is like for you and how you have gone, you know, how to deal with yourself and also your children and that component is very common, and we heard that in our survey as well. As there's children are EFMP and then also parent might be as well. And so that was a common theme. We'd be remiss if we did not thank some individuals for helping put on this survey. We are really thankful for the Ohio State University, who are our IRB sponsors, also the generous sponsors we have, the USAA Foundation, SEAL Kids, Teleteachers, Brem Preparatory School, Fairway Mortgage, Lighthouse Therapy. We're just really thankful of the support of our community, and we're thankful for our families for taking the time to share their stories with us. We at Partners in Promise are here for you. We also partner with other organizations like the Exceptional Families of the Military, and they offer support groups as well online. We are available to be a support group for our EFMP and special education families and EFMP adults. There are people here who are here to support you, and you are not alone. And thank you so much for taking the time to listen.